Nursing homes have borne the brunt of the coronavirus pandemic in this country, and some of the saddest scenes have been of seniors passing away with their families unable to be alongside them. Joining us now, Mark Parkinson, the head of the nation's largest associations of nursing homes and long-term care facilities. Mr. Parkinson, a New York Times study found that more than a third of all the deaths in this country from COVID-19 have been in nursing homes and long-term care facilities. Obviously, the elderly are an especially vulnerable population. Incidentally, this wasn't just patients. This was also some of the workers at that nursing homes. But why, beyond that vulnerability, why do you think such a high percentage of all the deaths have been in these facilities?
Well, Chris, you're right. This has been a horrible tragedy. And for those of us that take care of older people our entire life, it's been almost unspeakable. What we've learned from looking around the world is that any place where people live closely together, whether it's convents or dormitories or cruise ships or nursing homes, they're particularly vulnerable, and it's because of one very unique feature to this virus. And that is that this virus, unlike any other that we fought before, a person can catch it, show no symptoms, and yet still spread it. So in January, February, and March, when we didn't know that, we had visitors coming into our buildings, we had staff members in our buildings closely interacting with residents as they need to take care of them, and we were unwittingly spreading the virus within the communities. Once the academic community and doctors figured out that you could be asymptomatic and carry it, it was too late for a lot of people, and unfortunately, even then we didn't have the test to figure out who had it. The good news that I can give this morning is that we're now in recovery, though, Chris. I just want to point out that the Trump administration just on Friday allocated $5 billion. Secretary Azar, Deputy Secretary Hargan, right. That's going to allow us to recover and really make this better.
I want to point out another issue, however. The Government Accountability Office issued a report this week, and I want to put the numbers up on the screen. It found that 82% of nursing homes, over 13,000, have been cited for infection control issues from 2013 to 2017. Yeah. So the question, Mr. Parkinson, didn't your facilities have a problem in this particular area long before the pandemic hit?
Well, we have a real flawed survey system, and one of the flaws of the survey system is that surveyors are encouraged to give deficiencies, and what that does is it creates the impression that even very good buildings are not good. It makes it hard for consumers to figure out what buildings are good and which aren't when everybody gets deficiencies. That same GAO report reported that 99% of those deficiencies were not severe. They did not affect patient safety, and many of them were just paperwork issues. The reality is that the coronavirus violates all of the normal concepts of infection control because normal infection control is symptom related. Now that we know that, we are adjusting our behavior, and that is why we're starting to see recovery and people actually getting better. Visitors are no longer allowed to come into buildings. In every interaction, patients and staff now have masks on. Patients, residents are not eating together in the same room. They're eating privately in their own rooms. So that now that we understand the very vicious nature of this virus, we're able to control it much better.
Nursing homes in New York and New Jersey have been especially hard hit by the pandemic, as well as the entire states. And in late March, Governor Cuomo issued an order that nursing homes must accept COVID-19 patients to try to alleviate and prevent overcrowding at hospitals. Here's how the governor described it and explained it this week.
The CDC guidance said a nursing home cannot discriminate against the COVID patient because at that time the issue was hospital capacity, right? Remember hospital capacity? And we were dramatically increasing hospital capacity.
Did Governor Cuomo have to follow that CDC guidance, or did he have a choice? And what about other governors and how they handled the CDC guidance around the country?
Well, look, I've been a governor in the time of a crisis, so I understand that sometimes you have to make decisions based on incomplete information. At the time that Governor Cuomo made that decision, he was being told by the epidemiologist that his hospitals were going to be overrun with COVID patients. In hindsight, we now know that that was not the case. There was actually the capacity there. They didn't need to be discharged to nursing homes. In hindsight, it was an error. And to Governor Cuomo's credit, he has now reversed that policy. Fortunately, we were able to convince most of the other governors across the country to not institute that policy. And I think that's part of the reason that we're starting to see recovery.
But in fact, he did have a choice. He didn't have to follow the CDC guidance anyway.
Yeah, I mean, in hindsight, our suggestion to him at the time was that he didn't do that. I think in hindsight, he would say that it was an error. It was an error, again, based upon incomplete and inaccurate information. The country was too concerned with hospitals being overrun, and there were consequences to that. One of the consequences is that nursing homes were left out. Our residents were not a high priority for testing. We weren't given the equipment that we needed. You know, there needs to be some accountability for all of these people that were making these fantastic estimates that the entire hospital system across the country was going to be overrun. It wasn't, and there are consequences, and unfortunately, nursing home residents were one of the consequences.
I want to pick up on the first point you made, which is that we didn't know at the very beginning a lot of the particularly terrifying and dangerous aspects of the coronavirus, and one of them is that people could be asymptomatic and go into a hospital without any sign they're ill and then still spread the virus to these very sick people. The result, as you've locked down, is we've seen these terrible scenes where, for their own good, residents are kept away from their families, and some of them get very sick, some of them pass away, and their families can't be with them when that happens. What are your thoughts about reopening nursing homes, letting families be with the residents, and under what strictures, under what restrictions, so that the families can be together, but you're not endangering the lives of all the patients inside these facilities?
Yeah, we realize how hard it's been for family members and for residents to not be able to be together. And, you know, we've tried to offer FaceTime and all sorts of other alternatives, but there's just no alternative to being together. And then the tragic scenes of people dying without their loved ones, it's horrible. The most important thing is that we need to keep COVID down in the communities that the nursing homes are in. If a nursing home is in a community that has very little COVID, there's not that huge risk of it getting into the buildings. If we spike back up in COVID cases, though, we're going to end up with more COVID in nursing homes. So issue one is let's keep COVID down in the communities. Issue two is let's get adequate testing so that we can get a test of every staff member, every resident. And then ideally, if we could get on-site testing throughout the summer so that when people come in, they get a test, we know that they're COVID-free. That would be the ideal. But we do recognize it's extremely important to get these folks back with their families.
Mr. Parkinson, thank you. Thanks for taking time out to talk with us this weekend, and good luck in your efforts to reopen these nursing homes, sir.